ourselves. First of all, is to apologize for you guys staying for so long and waiting for us. Jockey has done a commendable job to keep you waiting. We've had a long meeting with the Ministry of Health. I am Achari Gakuru from Kidney Research Kenya. We've been working on renal health in Kenya for the last 10 years, training doctors, nurses abroad. I am one of those people they call diaspora. So I'm from diaspora in the UK. However, we've been working on renal health for the last 10 years, putting dialysis centers and also training doctors. With us, we have brought doctors and specialists from China, Yunnan province, Peking University, BTIA that deals with renal health, because that's what we've been dealing with for over the years. And what happens is that out of our relationship that we have externally, we have come to give something back to the nation of Kenya. And the way we have come to do it is to try and bring expert knowledge to this country, bring renal centers from this to this country, but also to train nurses and doctors abroad. So with us are three organizations. That's us, Kidney Research Kenya. Then we have Professor Zhu, who will introduce himself. And then we have Yunnan province, and they will also introduce themselves. What we are giving Kenya is a unique service that covers or encompasses anything to do with renal health. From simple things like training, I'm calling them simple because they don't involve a lot. Then we have the renal centers, and we have manufacturing, pharmaceuticals, and transplantation, kidney transplantation. All those things will be encompassed in the service that we are offering. So it's a whole service that we'd like to give to Kenyans, and it's a service that we've been working on for the last 10 years. So I'll give Professor Zhu first an opportunity to say what we are doing, and then we can move on.
Hello everyone, I'm Professor Li Zhuo from Peking University People's Hospital, a renal doctor. So also I'm the president of Zhongguancun Blood Purification Innovation Alliance. The alliance is composed of nephrologists who take care of patients with renal disease and take care of patients of hemodialysis, peritoneal dialysis, and patients after transplant. Our member also composed of renal companies. We produce renal drugs and renal machines like dialysis machines, dialyzer, and tubies. So what we can do to help Kenya in renal care, patient care, I think is about two aspects. First is about the training of the staff members. We know that in China 20 years ago, we have only 70 per million population, the prevalence of renal dialysis. But today, the prevalence of renal patients on dialysis is about 400 to 500. So the number of patients on dialysis is increasing very fast. So staff members entering the service area is also increasing very fast. So the training demand is increasing very fast. So a very important task of our alliance is to provide staff member training. So I think we can provide the renal centers, private or public in Kenya, the training program. The training program is divided into three parts. The first part is the online, which is very time-saving and money-saving. The second is for manipulation and simulation training. So we have do renal puncture and do dialysis for pseudo-human. The second part of the training is in clinical practice, to observe the clinical practice. So after the three parts of training, employee can do his work privately or separately by himself. So the first thing that they can do is provide to Kenya renal service. The second is the national standard of renal service. You know that because there are so many patients into the dialysis, so many staff members into the dialysis, so we need a national standard to standardize the hemodialysis and peritoneal dialysis procedure, to standardize for the safety of our patients. So we can also provide the renal dialysis, peritoneal dialysis, and renal transplant for the patient management. So I hope that our alien can do something for Kenyan renal service to improve our patients' quality of life and their survival. Thank you.
So how we have organized the meeting, before I give the other organization a time to do, is that we are going to all the sections of the government, of the renal service providers. So Ministry of Health, KEMSA, Poison Board. Tomorrow we have a meeting with the students from 11 o'clock. We have about 50 students who are preparing themselves for the scholarships that we've been offered. But more importantly, it's also to engage with the professionals, the renal surgeons, and also nephrologists in our country, and nurses, so that we can work together towards improving this service. So I'll give our colleagues the opportunity from Yunnan province to say something. I don't know whether you are...
So we are from Renal province, China, and we are the largest medical investment group in Renal, and we are a sub-company of that group. And here, our company name is Yunnan Yunyi Qiandao Science and Technology Company, and this is our general manager, Ms. Hu Fei. And here is Deputy General Manager, Ms. Su Ling, and me is General Manager Assistant, Yongquan Li. And our company majorly have 4 parts. And first part is doing the selling of equipment and consumables in renal health. And the second part of our company is to invest in renal health and other medical health projects. And we do specifically like renal health center, and also we do renal related pharmaceuticals and equipment production. And the third part is that we also operate ourselves. We also operate the renal health center with ourselves. And the last part we do is that we do training programs, like we're training renal related nurses and doctors, and also we are talking about program to Kenya is that we want to train Kenya nurses and doctors. We want to send them to China and train them and send them back. This is what we do. And so with this trip to here with KRK and BPTIA, we want to we are a service provider, like the largest renal health service provider in Yunnan. We want to provide affordable and the greatest renal health equipment and other health to Kenya.
And part of what they will do is help in manufacturing, and also very importantly that we have a lower cost of renal and dialysis services in Kenya. So that's the whole gist of what we're trying to do, to transfer that to the patients and to transfer that to the government as we move along. So our suggestion was that we do level 4 hospitals in Kenya, renal services, and also what we call the rural areas renal services, whereby we can manage to bring the dialysis centers nearer to the patients, so that we can manage to get the people treated, and also we have an escalation process which enables us to get the patients out of dialysis into a normal life. So that is very, very important for us, and that's why we tried our level best to find the best solution for Kenya. And we think that what we brought here is the best solution that we can have for our country. So I'm hoping that Kenyans will buy it, but more importantly, the people who make decisions, that will see value in what we're trying to do. And also being a part of the diaspora community, there are many others out there that want to do something for the country. And they are sometimes, I must say, frustrated by the sound of the way that things sometimes happen. But we are grateful that the Minister of Health, Dr. Rashid, offered time for us, the CAS, to see and listen to what we had to, and others that are used to are specialists in renal. So we are thankful for the government for offering the service.